In Africa, let's cross to West Africa, Nigeria, Abuja, to the country with the biggest population in Africa. Ajik Mangut, why on earth are doctors on strike in the middle of a coronavirus pandemic?
That's right, Maria. I spoke to the president of the Association of Resident Doctors in Abuja, and he said that there's no better time to actually go on this strike because they had given the FCTA, that's the Federal Capital Territory, an ultimatum to say they should pay their salaries and their arrears, but the deadline had expired. And it so happened that when they were going on this strike, the third case of the coronavirus, was announced in Nigeria. So he's saying that it might be a coincidence, but for doctors to actually fight this virus and other diseases in the country, they have to be motivated. Their salaries have to be paid, their arrears. And they also complained that for those who were paid, they were paid in percentage, like 5% of their salaries. And the government needs to pay them their salaries for them to be able to deal with this crisis.
I hope that is resolved. Incredible, as they say. No better time to go on a strike. Tell us, Ajik, how then is this going to affect the government's efforts to contain the virus of the spread, especially in a city like Lagos, where most of the cases are, and that has 23 million people living in that city?
You're right, Maria. Well, for now, the doctors in Abuja are the ones going on strike, and the case of coronavirus, thankfully, has been limited to Lagos, where we have 2 active cases. The latest case is that of Nigerian who returned from the UK. Hopefully, that does not, escalate to other parts of the country, because the resident doctors are saying that apart from them, other health workers might join in this strike because they also have their demands to be met, like promotion arrears that are yet to be paid. And we just hope that this does not affect government's efforts. But we know that so far, the government set up a task force that's yesterday headed by the secretary to the government of the Federation in terms of looking at containing the virus in terms of testing and also reporting back to the president. It has the Minister of Health in that task force, the Minister of Information, and they'll be looking at ways in which the virus can be contained, and it does not go beyond Lagos State. Other state governments, also like Katsina State, have also started putting measures in place in case this spreads to other states.
Okay. Ajik, thank you so much for that update from Abuja.